Good morning. It's a rant this morning, I'm afraid. This is our BT telephone. And on Friday, I listened to the evening news and I was aghast to hear that the conditions that I had to meet to actually see a GP in person were going to continue after this virus. And the conditions are, of course, that you phone for a phone consultation, and this delays you seeing anybody for 4 or 5 days. And then the doctor gets back to you at a given time on the telephone. And then after a 5-minute consultation by phone, where he can't see you and make any sensible assessment, he decides whether you're worthy of a face-to-face consultation. So after listening to this on the news, I fired off an email to a local broadcaster who deals with, fielding answers and responses to complaints of the public. So here it is. I am seething with rage about last night's news bulletin that spoke of a decision taken by so-called managers in the health service to totally alter the way that we do doctor-patient consultations. We are to continue the dreadful phone consultation evaluation assessment setup installed under lockdown conditions. This massive decision, we are told by smiling medical managers, is to be continued because it is more efficient. Catchphrase for saving money. This massive important decision affecting all our lives has been taken with zero consultation or discussion with the public, the people who actually pay for the service and use it. I feel this is really about, I know what's best for you. As a result of the virus, new emergency legislation power has really gone to the heads of many figures in authority. And we are really in a totalitarian dictatorship. How can anyone at the end of a phone make any proper assessment of what is going on with a patient? The patient or the doctor cannot see the patient move or talk in the flesh. Making an important health decision based on a phone call is ridiculous and preposterous. It will lead to serious health issues being missed. I go on to say, face-to-face consultations save lives. Over the various lockdowns, I read of quite a number of instances where patient over-the-phone consultation worries were ignored and fobbed off. The patients in question had probably seen all the government adverts ordering and guilting them to stay at home and save lives. And sadly they did. And as a result, patient early diagnosis of cancer, growths and heart problems were not picked up, and they went on to develop rapidly, and some patients died. Visual diagnosis of cancer or any other health worry like health problems is essential to saving lives. Attempting to make any proper diagnosis over the phone is complete nonsense. We've already lost so much in the NHS. We are now being informed by doctors that we need to go private if we want an urgent operation. Who can pay? The alternative is to endure 3 or 4 years of agony waiting for the NHS to do the operation, if they ever do. I didn't clap the NHS outside my door for this further dilution of my health provision to be ushered in without discussion. During the sacrifices of lockdown, I thought I was doing my bit to save the NHS. Now I see healthcare being diminished even further. People I know, and old people in particular, want to see a doctor face to face. They trust a familiar face for reassurance. A phone call does not cut it. What will people do? They will go to A&E to be seen by someone, a human being. A&E will be inundated. Phone consultations, if they work, will merely delay any necessary medical response. The patient will have to phone, and if they get through, they will have to wait for a doctor to phone back days later. Only then will a doctor, on the basis of a 5-minute phone call, make a decision to see them. We know of a little girl who during lockdown developed a small lump on her head. The phone doctor didn't know her, but assured her mum that it was all well and that this kind of thing would soon disappear. 3 phone calls later, and several months went by, and the mum had had enough of being fobbed off. Sick with worry, she took her child to A&E, where a cancerous tumour was diagnosed. So much for early intervention and for phone consultations. Yours angrily, Tom McClean. I am further surprised that this story isn't on the front page of our local newspapers, because everyone I talk to agrees with what I'm saying. So there you are, folks. That's my wee rant over for today. Sorry about being so negative, but whenever I first heard this on the news, I just sat back in disbelief. What is being pushed through under these various emergency powers? You know, what's coming in by the back door that people, most people, are not aware of, and they'll be bedded in and can't be changed until, you know, it's too late to do anything about it. So there's my wee email to a local news broadcaster. I've heard nothing back from him either, of course. So what do? You phone your MLA? Well, I've done that as well. But whether anything does any good nowadays, I don't know. The small man appears to be totally insignificant. The government, the Assembly just can do whatever they jolly well please. And we're all going to reap the whirlwind of that.